Good evening. Thank you for joining our webinar on our private GP service. My name's Louise, I'm your host this evening. Our expert presenter is GP Dr Fiona Warner. This presentation will be followed by a Q&A session, and you're welcome to ask questions during the webinar via the Q&A icon at the bottom of the screen or at the end of the session. You can do this with or without providing your name. Please note that this session is also being recorded if you do provide your name. If you would like to book a GP appointment with Dr. Warner or one of our other GPs, there's be a link at the end of the session. And now I will hand over to Dr. Fiona Warner. Thank you.
Thank you very much for the introduction. Yes, I'm one of the GPs working here. There are several of us that all provide the service, but I'm just going to talk very briefly through what we can offer you today. Thank you for tuning in and listening. I've not done one of these before, but I hope that you'll find it very useful. Just a little bit to start with about me, my background. I was brought up in Kent, actually, and I went and studied medicine in London at King's College, and I qualified in 2001 and did my house training, all my junior doctor jobs in various different hospitals in London. And then I qualified as a GP and worked as a GP for a few years in London before returning back to Kent when I started a family. I really enjoy general practice. It's a job that I've always found extremely fulfilling. I work currently as a GP partner in Rye, in a practice in Rye, and I work part-time. And then I do a session a week here at Benenden, and I joined here in 2019. I have a wide range of interests in general practice, but I have a particular interest in women's health and sexual health. Sorry, bear with me. What do we offer at Benenden, and why might you want to choose to book an appointment at Benenden Hospital? One of the main reasons that people like to book an appointment at Benenden is because you get a 25-minute appointment. For a lot of patients, they find that they might want a little bit longer to discuss a particular problem, and having a 25-minute consultation will allow that process to take place. They might also want to discuss a couple of different problems as well, and it can enable us to give a slightly more holistic approach if we have a bit of a longer time to address all the issues. We offer face-to-face appointments, and that enables us to be able to perform examinations and do procedures if we want to as well. You are able to book online for the appointments, and often there can sometimes be appointments available on the day or certainly within the week, so you can usually access fairly quickly. And there's a variety of different times that you would be able to book these appointments. We also have an on-site pharmacy, so if you need to make an appointment and you are issued a prescription, you can also get it at the same time. So in this session, I was just going to talk a little bit about the most common presentations that we would see here in general practice. General practice essentially covers everything. We see a variety of different conditions, and as most of you probably would have experience of general practice, you know sort of things that we cover, but I'm just going to speak about the usual. I'm just going to speak to you about the most common presentations that we tend to see. So we'll cover general health concerns, digestive health, ear, nose and throat issues, aches and pains, urinary problems, skin conditions, mental health, women's health, and we'll go from there. So these few sections are the most common things that we that I spoke about these. I suggested these because these are the most common presentations that I tend to see here at Benenden. So mental health, joint pains, digestion, menopause, and any ear, nose and throat problems. So common digestive conditions that we might, that patients might come to talk to us about include abdominal pain, changes in your bowel, acid reflux or heartburn, rectal bleeding, dysphagia, which is a difficulty in swallowing, nausea, and irritable bowel syndrome. If you presented with any of these problems, we may be able to offer you medication that could benefit you. Sometimes it's just a case of discussing lifestyle changes. We might assess you, do an examination, and then feel that a gastroenterological referral would be appropriate, and we might suggest referring over to a colleague for a further opinion. We might suggest that it would be sensible to perform some diagnostic tests. We can arrange blood tests, which can be done directly on the day, scans possibly at a later date, but we can also refer for other investigations such as endoscopy, gastroscopy, etc. Ear, nose and throat, common conditions that people might present with, again, so hearing loss, sensation of a blocked ear or wax in the ear infections or tinnitus. So obviously we can perform an examination, take a history, examine the ear, and then if we're able to give treatment, we can offer that. We might also suggest referral elsewhere. Common conditions with the nose, blocked nose, sinus infection, headaches, hay fever, and the throat. People sometimes present with difficulty with sleeping and sleep apnea or persistent sore throat. And these can all be things that we can advise on, possibly give medication for and refer. I've probably covered that slide, that there is also options to be able to refer for flexible nasal endoscopy here at Benenden. General aches and pains. This is an extremely common presentation, again, that we see, and we can give advice on various different aspects of managing joint pains. The most common joints, obviously, shoulder, hip and knee, foot, hand, elbow and neck, and back pain. There are many different causes for possible joint pains. It can be related to injury, or it can be a longer lasting problem. Osteoarthritis is essentially a term we use to describe sort of the wear and tear type arthritis. There can sometimes be other conditions such as rheumatoid arthritis, which is a condition that can present slightly differently to osteoarthritis and affect joints slightly differently. Sprain or strain if there's been an injury, but also other conditions such as gout or a possible infection in the joint, although that's not quite as common. We can give information about how to manage pain with medication. We can give advice on lifestyle. We can give advice as to whether physiotherapy would be beneficial for you. Here at Benenden, we're able to offer referrals for a scan or for treatment. If it's simply for something like an X-ray, often that can even be arranged the same day. If it needs a more in-depth scan, such as an MRI or a CT, we can refer for that from the GP service. But you would need a later appointment for that. There's also options of joint replacement surgery or joint injections, again, which we can refer for. Urinary problems. So urology is the area of medicine that deals with diseases of the male and female urinary tract and their reproductive organs. For men, the most common presentation often will be prostate enlargement, but we also see a lot of what we describe as overactive bladder. So that's often when people have just an increased frequency in urination, often getting up in the night to go to the toilet. Urinary incontinence, we also can advise on. Sometimes people have a history of bladder stones or colic, renal colic, or recurrent urinary tract infections. One of my colleagues, one of the GP colleagues that I work with, Dr Kondagari, is a particular specialist, has an interest in skin conditions and actually does run his own dermatology clinics. He is very good skin. Obviously, all of us are qualified to be able to also give advice in this area. And common conditions, again, that we might see: cysts, acne, dermatitis, eczema, shingles, fungal infections, mole changes, and rosacea. and we can advise on oral treatments or medicated creams that might help with these conditions. We can also offer screening for moles if anybody has any concerns about these types of conditions. And we can also refer on to dermatology if we feel that a more specialist opinion would be required. Mental health conditions are quite common to present with here at Benenden, and I think another reason why that is because we're able to offer a slightly longer appointment to be able to really talk about symptoms that you might be having. The most common presentations are usually depression or anxiety. There are obviously lots of different types of mental health conditions that also have very similar symptom presentations. So we can also talk about panic and agoraphobia, possibly also obsessive compulsive disorder as well. And we can give advice, again, possibly medication advice or lifestyle advice, or give advice regarding counselling and other ways to manage these symptoms. And women's health, which is a particular area of interest that I have. Again, this is something that we very commonly see here, or I certainly see a lot at Benenden Hospital. We can give advice about periods and menstrual bleeding, premenstrual syndrome. We can talk about contraception and birth control, pregnancy or pre-pregnancy advice, or concern or issues that have occurred as a result of pregnancy. Menopause is quite a large area that I cover, generally discussing HRT and other ways to manage menopausal symptoms. We can also discuss sexual health issues. Cervical smears, we offer that as a private service. There are some patients who like to attend for more frequent smears than is available in the general screening program, which often will only offer a 3-year screening. Endometriosis, osteoporosis. Osteoporosis is where your bones start to reduce in strength as you get older, and breast health. So just sort of talking more specifically about menopause, I would be able to offer advice about menopausal symptoms that you may be experiencing, and I can discuss options for hormone replacement therapy if this was something you might be interested in. We would discuss this in depth and discuss the issues and concerns that one may have about starting HRT, and discuss the risks associated with that and whether it's an appropriate option for you. We don't have to go down that route. You can also just take lifestyle advice on how to manage symptoms, but we also talk a lot about bone health and breast care. I'm also qualified to fit intrauterine devices and implants for contraception. So this is also a service that we offer through the GP service. And then just a little bit of information for you about the online booking system that's available. You're now able to book appointments online. You can see what availability there is. You can select which doctor you would like to see, and there's some information there about each GP and the experience that they have or the interests that they have. And then hopefully that makes it easier for everybody to use. Okay, so I've sort of flown through my presentation, and I'm very welcome to any questions anyone might have about the service.
Okay, thank you very much. That was very interesting. Okay, we do have some questions, variety of questions. The first, they say you mentioned there's an on-site pharmacy. They're wondering if they're able to get a prescription completed and take it away whilst they wait at the hospital.
Yes, absolutely. So it's just like any other pharmacy. So we would give you a prescription to take with you to the pharmacy, and as long as they have the particular medication in stock, but they do seem to stock a pretty comprehensive range of medication, then we're able to give you that medicine there and then.
Okay, thank you. Regarding mental health issues, do we provide therapy at the hospital for that? I obviously know we don't, but do you want to give some advice on where to best place to go?
Yeah, so we will often give advice. We work also by writing. So if you had an appointment to come in to see us, we would often recommend that we write to possibly to your doctor as well, to involve your NHS doctor, who would also be able to offer you a range of information and local services to you. But we can also give advice about how you can access counselling, possibly privately if that was a route you wanted to go down. But yes, we can certainly supply plenty of information about other resources where you'd be able to access counselling.
Okay, thank you. I've had a few people raise your hands. If you do have questions, can you please type them through the Q&A? Thank you. Someone has been considering getting the coil, but would like to see someone for more information. And they ask, with their long appointments with a GP at the hospital, would there be enough time to go through the risks and benefits just within one appointment?
Yes, I would say so. So we have 25 minutes in our consultation, and I believe that's plenty of time to go through all the issues, all the questions that you might have. It sometimes is quite helpful if you have been able to do your own research, because there is quite extensive information online if you look, although I know sometimes that can be a bit scary, because sometimes you can get caught up with Dr. Google and it can be a bit confusing. But yes, we have plenty of time to go through anything, and you're always welcome to make a further appointment if you wanted to, or if you find you have any further questions that you'd forgotten when you left the consultation room. You can always speak to the secretaries who work for the GPs, and if there's any questions that really need to be answered, we will always be very happy to do that.
Thank you. We've had a question around the GPs at the hospital having specialisms, and would it be best to book with those when available, or can they see any of the GPs? And I think the answer for that is that we do have a profile for each of the GPs on the website, with their specialisms, with the information that they're experts in, and it's quite a good idea to read through that and get an idea of who, if you need to see someone, a specialist, and see when they're available, or if you want to see the next person that is available.
Yes, and I think we're all, because we're all GPs who've all been doing general practice for quite a long time, so we've all got a similar level of experience, and we should all be able to cover each other anyway. So there wouldn't be a problem that you would come in with that we wouldn't be able to deal with. It's just that some of us may have a bit more of a knowledge or a bit more of an interest in a particular area. And if you have a specific problem that you want to discuss in that particular area, then yes, you might want to book with that specific doctor.
Can a GP advise on HRT for someone who's had breast cancer?
The answer is yes, they can advise. Whether or not they decide that they're able to prescribe that is very much down to the individual doctor, and also with very careful discussion of the patient. It's a very individual discussion that has to be made. But yes, it certainly can be discussed with the GP in this context.
Okay, thank you. I have a bit of a longer question here. As a woman in her 60s, this lady has experienced a level of discomfort when sitting at a desk or table for over a year now. It's a low level of pain and discomfort. After viewing the NHS Choices website, they've bought a good quality specialist cushion, which eases the pressure. And they thought this is all part of the aging process. They thought it's all part of the aging process, or is it kind of a minor issue concern? And is it a common concern? And is this the correct thing for them to be doing?
So I'm sorry, my screen switched off halfway through that, but so a discomfort when sitting.
A low level of pain when sitting at a desk or table.
So the first thing I would suggest is looking very carefully at the sort of ergonomics of your desk or your chair and how you're sitting, because sometimes it's just, if you're sitting for a prolonged period of time in a set position, sometimes it's not often chairs are not very well designed to support you in the right way. but if it's something that's happening all the time and causing a level of discomfort, I would seek advice on that. It could be a range of different problems which do need to be looked into. So it could be related to a problem with your back or your hips. It's definitely worth seeing a doctor to discuss it in a little bit more detail and have an examination so that they're able to discuss with you what options might help improve the situation and to ensure there isn't anything that needs further investigation.
Do we have heart specialists at Benenden Hospital?
We do, yes.
Okay. This person hasn't seen a private GP before. They're wondering if they need a referral to see a consultant at the hospital. Would you mind explaining the pathway afterwards if treatment was needed after seeing a private GP?
So you don't, yes, so we can just do, if you came to see, you don't need a referral to come and see a GP here at Benenden. Anybody can come in and be seen. You can just phone up and book the appointment or book online. If you then wanted to see a specialist in a particular area, or if you discussed an issue and felt that it would be we felt that it would be appropriate for you to then see a specialist, we can then do the referral for you directly to the specialist here at Benenden.
Thank you. And just a couple more questions. After seeing a GP, oh, where's your screen gone?
There we are. Oh, sorry.
Yeah, that's right. And if after seeing the GP and if they need medication, could you write an NHS prescription, or would you need to have a private prescription?
No, if they were seen here, they would have to have a private prescription. But we do always write to your GP, to your NHS GP. So if we started a medication for you, we will write to your GP, and if they're willing to continue to prescribe it, you may then continue to receive the prescription as an NHS prescription from your own GP. But from us here at Benenden, because it is a private hospital and it's a private consultation, you would have a private prescription.
Okay. And our last question, so Benenden referred this person to physio, where they had 6 sessions as recommended regarding hip pain. They ultimately recommended they have an MRI scan, and that went through Benenden back for Beta Health back to Benenden. They agreed that this would be the right way forward, and he said, can you suggest where I go from here to find out what's going wrong with my hip? So basically the MRI said that we can't help anymore. What else would they do?
So they've been through physiotherapy and they've had an MRI, and they were told that there wasn't anything further that the physiotherapist would be able to offer. Is that?
I'm thinking it's hinting at that Benenden Health bed to offer, so I suspect it'd be seeing an orthopedic consultant, I imagine.
Yes, yeah. So
the MRI didn't happen, they've just said, sorry, the MRI didn't happen.
Oh, okay, sorry. Yeah, so then it may well be a case of having a referral through to the orthopedic team to discuss whether there would be any benefit in any other treatment options.
Yeah. Okay, thank you. We do have a few more questions, but if you've provided your name, we will answer these after the event. And if you'd like to book a GP appointment, you can do so via the link on the page in front of you or via their phone number. You can do that online if you do via the website link. And the phone number is open 8 AM to 6 PM, Monday to Friday. At the end of this webinar, you'll receive a short survey, and it'd be great to get your feedback if you could spare a few minutes just to find out how we can improve for future webinars and to give feedback to Dr. Warner. Our next webinar is on the 5th of December, and it's on urology treatments for men. So on behalf of Dr. Warner, myself and my colleagues at the hospital, I'd like to say thank you very much for joining us today. We hope to see you soon, and thank you and goodbye, and hope you stay safe in this blustery evening. So thank you.
Thank you. Bye-bye.
Bye. Bye.